Welcome to Learn Medical Spanish. Today I'm going to go over some additional history sections that we haven't covered in a previous episode. So this includes medications, allergies, surgical history, social history, and family history. So these, you might word them a little differently depending on the chief complaint, but they're fairly similar. So I'll just cover kind of a general version of them in this episode. So as usual, this is both a podcast episode and a YouTube video. So if you're on one or the other, you can easily find the other one just by going to the video description or the episode description, and you'll find the links there. You can also find a link to my website, which has all the phrases listed, as well as a CME course that covers some similar content. But let's dive in. So you'll hear the English phrases first, and then I'll give you a minute to think about the translation, and then I'll say it in Spanish a couple of times. So each time I say it in Spanish, I'll give you a chance to repeat it after me. So try to repeat it out loud if at all possible, if you're in a place where you can do that, because you're definitely going to remember it a lot more easily if you repeat it out loud versus just looking at it. Here's the first phrase. So this is about medications. Do you take prescribed medicine? Toma medicina recetada. Toma medicina recetada. The word prescribed is in parentheses because you could leave that out. If you just said, do you take medicine? The phrase would still make sense. But if you want to add a little more clarity, a little more specificity, that's what those other phrases, those other words are there for. But whenever they're in parentheses on the video or on my website, then you could leave them out. Next phrase, which ones, meaning which medication or medications. ¿Cuál or cuáles? ¿Cuál or cuáles? So cuál means which one, and cuáles means which ones, plural. How is the name spelled? Meaning the name of the medication. How is the name spelled? ¿Cómo se escribe el nombre? ¿Cómo se escribe el nombre? Technically, that means how is the name written, but it's easier to say versus the actual way to say how is it spelled is ¿cómo se deletrea? So as you can hear, that's a little harder to say. So ¿cómo se escribe is a pretty easy way to say it. Are you allergic to any medicine? ¿Es alérgico a alguna medicina? ¿Es alérgico a alguna medicina? So alérgico is the masculine version, and if it was for a female, it would be alérgica. ¿Es alérgica? Which ones? So in this case, which medication or medications are you allergic to? Which one or which ones? ¿Cuál or cuáles? ¿Cuál or cuáles? So again, if it's singular, if you think it's singular, you'd say cuál, like which one. And if you think it's plural, you'd say cuáles. That's one word, cuáles. Have you had surgery? So of course, we're moving on to the surgical history. Have you had surgery? ¿Ha tenido cirugía? ¿Ha tenido cirugía? When? ¿Cuándo? ¿Cuándo? Point to where you had surgery. Señale en dónde tuvo su cirugía. Señale en donde tuvo su cirugía. A couple notes here. The reason it says point to where you had surgery is because that's a lot easier versus trying to ask them what body part, right? Because then it could get complicated quickly if they were explaining that to you and you didn't understand very well. But another way to say, if you want to ask them if they've had surgery, you can ask them if they've been operated on, which is like le han operado or le operaron de, which means they operated on you of the blank. Le operaron del apéndice. They operated on you on the appendix. So that's a common phrasing that you might hear. That's why I'm just kind of throwing that in there. But ha tenido cirugía is also fine. All right, so social history, at least the most basic part of the social history. Do you smoke? Fuma. Fuma. Or alternatively, you could ask, did you smoke? Fumaba. Fumaba. And if you want to put those together, you just say fuma o fumaba. Like, do you smoke or did you smoke? Fuma o fumaba. How many years? ¿Por cuántos años? ¿Por cuántos años? Do you drink? Toma. Toma. Use drugs? Usa drogas? Usa drogas? Which ones? Or which one or which ones, meaning which drug or which drugs. ¿Cuál or cuáles? ¿Cuál or cuáles? So, of course, you wouldn't say both of those words to your patient. You would either say cuál, as in which drug, or cuáles, as in which drugs, plural. Now, family history, just super basic. Have your parents or siblings had problems with the... I'm just changing that wording a tiny bit if you're reading it. Have your parents or siblings had problems with the... ... Sus padres o hermanos han tenido problemas del... Sus padres o hermanos han tenido problemas del... So naturally, this is leading into if you had a list of different conditions, or in this case, actually more like internal organs or body parts. Like, have your parents or siblings had problems with the heart, with the lungs, with the whatever? So we're going to do just a few phrases you could use, but then you could add more if you needed to add a different body part or a different organ system. So, heart, corazón, corazón, lungs, pulmones, pulmones, brain. And you could clarify, but this is just, have they had brain problems? Yeah, brain. Cerebro. Cerebro. Stomach. Estómago. Estómago. So that's just a few common body areas that you could ask about, but that previous phrase where it said have your parents or siblings have problems with this body area, you could obviously add a lot more things after that. And then if you wanted to clarify, you could say, what problem? Now this might give an open-ended response. So usually we do yes and no, but here just to throw something in case you wanted to ask them, what problem? Like what heart problem, what lung problem, etc. What problem? ¿Qué problema? ¿Qué problema? So naturally, you'd only use that if you think you might be able to understand them. So if you really don't understand hardly anything when the patients talk to you, then you would probably not use that question. All right, so that was the last phrase for today. So if you want to see that list of phrases written, you can go to my website. The link's in the description, the episode description. And there's also a podcast version if you're on YouTube. If you're on the podcast, you can go to YouTube. So those links, you can always find those links in the episode description on your podcast app or in the video description on YouTube. And there are also links to the CME course, which goes over some similar dialogues and covers a lot of common chief complaints in the emergency room. So thanks for listening, and I'll see you next time on Learn Medical Spanish.